problem. Maybe you can tell us a little bit about what you worked on with the Harvard Global Orthopedics Collaborative in Ethiopia.
Yes. So we are trying to. So the long term strategy for this is to develop recommendations for improving trauma care to the Ministry of Health. But the problem is that there's a lack of epidemiology for trauma in Ethiopia right now. First thing we're doing is like the first stage of the project, we're sending surveys out to orthopedic surgeons across the country just to establish a baseline of what they consider their biggest problems or their most, or at least prioritize the biggest challenges and barriers to orthopedic trauma. The Ministry of Health has approved the spirit of the project. Now we're just getting the IRB done, but the survey is already completed. So the second the IRB is done, the surveys get sent out and it should come back within a couple months. After that, I think they meet and personally rank every challenge that was stated in the survey. Then after that, they come up with individual ways to tackle them. Sorry if that seems vague. It's just that there's a lot of it that encompasses.
No, it's a good summary. And the reason I was asking about it is the American College of Surgeons has also been working on similar things with some of our colleagues at the Medical College of Wisconsin and Virginia Commonwealth University that have been involved, but from not just the orthopedic side of things, because orthopedic trauma wouldn't include things like brain injury, right? It wouldn't include things like isolated chest trauma or isolated abdominal trauma. Whereas trauma broadly would include all of those things. And so the American College of Surgeons and the folks from Wisconsin and Virginia have been trying to work on how to help the Ministry of Health assess their system and what they need to work on. And they've drafted some trauma systems documents. The Ministry of Health has. I don't know to what degree the Wisconsin folks have contributed to it, but they're the ones who sent it to me, so they must have contributed to it. Those two institutions are those institutions that we're working with, Virginia and Wisconsin, as well as the American College of Surgeons, for our work in Hawassa, Ethiopia, which is again focused on trauma systems and surgical skills. So there's a lot of overlap, and this often is quite common across settings, is that there are multiple different partners who are all working on the same topic, but nobody knows each other. And sometimes there's good reasons for that, and sometimes there isn't. Sometimes there are individual partners that they're working with are in different places and don't necessarily overlap, and so there's parallel conversations. And sometimes the ministry just has this perspective of, the more the merrier, the more connections, the more resources are available, more support there is. And so there's also that perspective. So I'm not surprised to hear that the Harvard group is working on trauma systems in Ethiopia in parallel to the American College of Surgeons and multiple other institutions. I think maybe what we should do is see if we can invite whoever the lead person is from the Harvard group to come present here, and we can also invite the Virginia and Wisconsin folks so that there are periodic ways to kind of share that information across, like have a forum to share that information. And maybe that's one way of doing it.
I will certainly pass that along.
Yeah, can you remind me who the lead person is at Harvard?
His name is Dr. Kiran Agrawal Harding.
Okay. All right. I don't think I know that person. I think maybe that's something to discuss. But yeah, let them know that there is ACS led work that is trauma related that's happening as well. So if they want to invite the groups that I mentioned, that might be a good thing to do too, you know? So just that there's some attempts at trying to integrate and not work in silos in parallel.
Absolutely.
Yeah. Great. Well, thanks everybody for joining. There's not a specific speaker today, and as you heard as you were coming on, Cameron is a medical student at Northeastern Ohio Medical School. I think, is that right? Neomed?
Yes.
Cameron? Okay. And so he was suggested to join on our Works in Progress to see if he can get involved in various projects with us. And he's been involved with this needs assessment through the Harvard Global Orthopedic Group for trauma systems in Ethiopia, which incidentally we're involved in with American College of Surgeons. So we'll see how this all works out. So great. Well, thanks, Cameron, for talking about that and discussing it. We can kind of go around the room, kind of give updates on various things. I know the one update I have for Rachel Koch, who's our trauma acute care surgery fellow, is that she should be on her way to Colombia at the moment, the next sort of 10 days, 2 weeks, to help us figure out whether there's whether it makes sense for us to have a collaboration between our institutions here at the U and a couple of different institutions in probably Colombia. It's still kind of a complicated process to negotiate. So she's trying to figure out some of that right now. And then, so that's what's happening in the Colombia partnership. And then in terms of what's happening with several of the Rwanda related things, you know, a lot of the projects are up and running and moving in lots of directions, and hopefully some small aspects are coming together and wrapping up. There's several different papers that are in progress or being submitted that have to do with looking at the trauma systems in Rwanda and looking at the epidemiology of trauma care and looking at trauma quality improvement. So that's all continues to be in progress. And then our major project to develop software and implement software for coordination of pre-hospital care is moving forward, and the planned implementation is in a little less than 2 months, which is going to be quite interesting. So, and that's for a software system for at least the capital city of Kigali, of 1.2 million people, which is about the size of Salt Lake City. So we'll see how that goes. Yeah. So yeah, that's sort of, those are some of the main updates I can think of off the top of my head. Yeah, if you want to, folks want to go around. Laura, do you want to talk a little bit about your project and where things are? And Laura, you're finishing, you're graduating with your master's degree later this summer.
Yeah, hi everyone. Yeah, can you hear me?
Yes.
Awesome. Well, hi to everyone. So I am Laura. I'm from Colombia, and I am finishing my master's in clinical investigation. I'm part of the Track 3, which is related to innovations and technology to solve different like global health issues. I am currently working on a prototype for patients who had a decompressive craniectomy. And well, basically as an update, I've been kind of like developing a scoping review to like better understand what other prototypes have been developed. We finished the scoping review. However, we are waiting for we had to create an LLC to get the money from the competition. We won the award we won because we need that money to submit the article to the paper, to the journal, sorry. So we need that money. It is completed. We just need to wait for the LLC. Once we have the LLC, which is like a tiny company, we have to create a tiny company in order to get the money. And once we get the money, then we will be able to, you know, submit the journal, the paper for revision. And then the other part of the project is actually to test the prototype. We are currently developing the protocol for that. And basically what we want to do with this new study, which is going to be a multi-center prospective cohort study, we want to develop a prototype that performs safely and effectively in humans. So we are developing and writing that protocol. I wanted your opinion actually, Sudha, regarding uploading or submitting the protocol in clinicaltrials.gov. Do you think that should be, that should happen?
Yeah, absolutely. If you're doing a prospective intervention based study, you absolutely should put it in clinical.
Yeah.
Yep.
Yeah, so once we finish the protocol, we want to be, uploading the protocol to clinicaltrials.gov. Then we will send the protocol, of course, kind of like at the same time, we want to send the protocol to the IRB so that we will get the approval. And once we get also the money from the once we have the LLC, once we get the money, then we can submit the scoping review and also start the study in both centers in Colombia and Venezuela.
How many institutions across those countries are you planning to file this in, and what kind of sample size are you looking at?
Well, we are planning to, actually I have a meeting in 1 hour with the statistician because we want to talk about the sample size. But regarding the centers, we are planning to test the prototype in 2 centers in each country. Both centers are located in Valencia, Venezuela, and the other ones are Bogota, Colombia, both of them. And the reason of that is actually because we can have a lot of control in those centers. Like I live very close to those centers, so I can go there and do the follow-up and, follow up the patients like very closely. So that's why we chose these centers specifically.
Fantastic. How many patients are you planning on enrolling at each center?
Well, that's what we are going to talk with the
Oh, the
statistician.
statistician about. Gotcha.
Yeah.
Gotcha. And what is your primary endpoint that you're aiming to study?
Well, actually, what we wrote for the competition was very, very helpful because we want to assess many different variables that are patient variables, but that are also prototype variables. We have to see, of course, the clinical outcomes like length of stay, mortality, etc. But also we have to test the prototype features like functionality, safety, comfortability, usability, disposability, like all of that. So we are going to talk with the statistician about how are we going to do that, and then we will establish the sample size. We are going to assess, like regarding the prototype, we are going to assess like the fitting time by the neurosurgeon, the nurse, the patient, or the caregivers to put on the prototype. We are going to see if the prototype is compatible with all of the hemispheric decompressive craniectomies because there are different sizes. We have to be careful with that. Usually the international guidelines, they say that decompressive craniectomies have to be 12 centimeters length. And we need to see if our prototype covers most of the craniectomy sizes. And we are also planning to take cultures, microorganism cultures in the prototype and the patient's skin to see if there is any growth of microorganisms, because that's important. We want the prototype to be washable and like water resistance to avoid that specific issue. We are also going to assess how easy it is to use the prototype, if you can perform daily activities like walking, resting, showering with it, if we avoid pressure injuries with that prototype, how many hours a day does the patient use the prototype? Is it going to be 24 hours a day? Is it going to be 8 hours a day, etc.? What else? But we are also going to assess how, like, the production time, the packaging, delivering, and the costs.
Yeah,
That's important for also for the next step, which is related to the marketing thing. And regarding the patient, we are planning to observe in the initial CT scan and the follow-up CT scan if there's any change, clinical change within the CT scan features, if there's any change. Usually those patients, well, not usually, but some patients develop the Triphind syndrome, which is a herniation of the brain mass. And we want to see in the CT scan if that is corrected by the prototype or not.
that's what a fantastic project. It's just amazing that you've put that together in this last year, Laura. Just phenomenal that you've gone from an idea, a clinical problem, to a prototype, and you've produced it, and now you're in the process of actually moving forward with such an exhaustive and methodical testing process. That's phenomenal.
Oh, thank you. Thank
Yeah.
you so much. And I saw your message. I will definitely email you.
Yeah. And Hafsa and I were just exchanging some messages. Hafsa, I don't know if Laura, if you've met Hafsa, but she's one of our new team members who just completed her master's in public health and has a lot of statistical and study design expertise. And so she's joining us as part of the center staff. And she's available to help with any of the discussions that you're having with the statistician or developing fleshing out the protocol, things like that.
Awesome.
So, I hope you both can connect. Laura, I would suggest that if possible, that you have Hafsa attend some of the meetings that you have, and share with her the materials that you have, and you can ask her for input on how to organize it from a sort of research standpoint.
Awesome. Would it be possible to have her email so
Yes.
that I can?
Laura, I will just share it with you.
Oh, thank you. Thank you so much.
Yeah, fantastic. And I'll also send you, Laura, the usability survey that we just created and used in Veranda. You may or may not find it useful, but you could look at that in a couple of different ways of looking at usability, and you can see what you think.
Awesome. Thank you.
All right, amazing work. Congratulations. And all of that you're going to be able to do with the funds from the competition?
Oh, well, we are also planning to get money from other places. So yeah, we are working on that. We had some issues with the which was also interesting. We learned about it with Brian during the classes, and some of the team members said, look, I'm in med school, or I don't have time. I have to, I cannot continue with this. So all that legal part was also important, and we've learned a lot.
Yeah, that's fantastic. And I don't know if you have you connected with Mo Sabai yet, or no, or
we did connected a couple of, I think 2 months ago, but I have to update him on this.
And only in part because as a neuroscientist, Mo, I assume that you may have some interest in her technology, in her not technology, but her device.
Yes. She, I mean, she's right. We communicated, and my understanding is they were still tweaking some of the features. The device, but yes, please reach out whenever you can.
Absolutely, Mo. Thank you so much.
Yeah, and the reason I was mentioning it is that maybe there's an opportunity to actually apply for funding either through the University of Utah or through even federal grants and things like that. So we would just have to explore that, because that would be much more substantial amount of money, and it would be more complicated to
Yeah.
to have partners in other countries that have to kind of work out the financial aspects of it. But there may be some ideas there of how to actually study this in a much larger scale, if there's need for that.
Yeah, I was
Absolutely.
checking there is a brain disorders grant from the NIH, from Fortis Center, and I was just checking it in case we at some point we wanted to apply. And yes, of course, we would need a lot of guidance on that because yeah, we need a team and we need like more things too.
Yeah, I think that could be that could be valuable.
Mhm.
Just something to consider.
Okay,
Yeah,
awesome.
fantastic. Okay, great.
Thanks.
Nice work. Anybody have any other questions, thoughts, suggestions for Laura's project? And yeah, great. Okay.
So
Laura's-
just keep in touch, as far as
Yeah.
I'm concerned. Just keep in touch.
Yeah.
Let me know.
Sure.
Keep me in the loop.
Mo, do you have any updates on your project? I know that Cody, one of the medical students, was going to meet with you and Anna to see if there's any sort of curriculum development that could be supported. What is happening with your big project? That's
Yeah, Anna is definitely definitely in, and I'm very grateful for that. So we were in the last several weeks, we were racing against the deadline that was imposed to us by Rotary International. They spend a lot of money in COVID, so they don't have a lot of they're cutting left and right. So they give us a deadline of actually early last week, and we were able to beat it up, and we're all set. We're looking at starting the project hopefully in the fall of this year, because July, August, and September it's too hot over there. So we're starting hopefully the fall of this year, and I'll be communicating with Anna and Cody in the next few weeks and get the ball rolling. Yes. And Cody, I talked to him about the possibility of him going there to the clinic and then doing like a small rotation, short rotations, maybe 10 days or a couple of weeks. We will find something for him to do, I'm pretty sure. And so that will help him with his medical school prospects.
I
don't hear you.
I hope that he can help you though, Mo, with your project. I don't want to spend your time finding him a project in some ways. I want to make sure that he's able to contribute.
Oh yeah. It's going to be mutually beneficial.
Yeah.
Trust me. Yeah.
I think that would be great.
Yeah.
And what we will start to do starting in hopefully July is for this next year, create roles for students and trainees and at various levels to have formal engagement with us, specific mentors, specific projects, and kind of write that out so that there's some accountability mechanism and there's some understanding of what resources they need or have access to, so that they can contribute in a useful way for
Yeah. That's an awesome idea. We already have, I think I mentioned it to you and in my talk, we already have a similar partnership with the OT department, where we select a few students every year, and then they travel to Morocco and we give them projects to work on. So they are free laborers because they are master degree students, so they already have some clinical skills. But for them, it's an international experience. They have to work hard on their project and report back to us and to the College of Health. So
yeah, I think it would be great to have something very similar, but for medical students. And this can be a great forum for us to have have them present and kind of update and get input and things like that.
Yeah, Anna just texted me. She said, I wouldn't mind going either.
Yeah, all of us.
Of course, Anna. That's part of the plan.
Fantastic. Okay. All right. Well, I'll just go around the room. Brad, I know you have a lot going on at all times. So, any updates on your collaboration for plastic in Ghana? And by the way, one of your colleagues just reached out to me just a little bit ago, and I also will mention that in a few minutes. Dana John reached out about a partnership with Operation Smile in Guatemala, and how could we engage with an exchange program. And so I haven't responded with any detail of anything yet, because I don't fully understand what they want to do. But I want to mention that to you so that
Oh, good.
also have you have all the information I have.
Yeah, so for Ghana, the fellowship front, nothing new. We have the breast plastic surgery fellowship is in the works through the Ghana College somewhere. The general surgery breast cancer is written but not submitted, and I think that'll be on hold until there's a new president of the Ghana College. Gia Lewis would like to go. Just a few days ago, she sent me some dates in October that she could go, and I think our plastic surgery national meeting is like right in the middle of the 2 weeks that she said would be good for her. So I'm not sure those dates are going to work, but we'll keep working. I have written a burn fellowship curriculum. I don't think they've submitted it. I don't know if they want to. But if Gia goes, that would sort of give a little push in that direction. And then I just found out the Paco Hoyt Williams, who's now the plastic surgery chief, would like to become a professor. And to do that, he has to write some papers. So he just sent me one. But I think research will become more of it's sort of been an interest, but a sort of more urgent interest for him. So hopefully he can become a professor. Yeah. So can I ask about Dana Johns?
Yeah.
So she, I don't know if you know, she has gone to Guatemala with a sort of Utah organization called Hershey Smiles. And Dr. Hershey was a plastic surgeon in Provo who unfortunately was flying his own plane and ran into the peak of one of the mountains in bad weather and died. But I think that organization still exists. So Dana has, I'd say for 5 or 6 years, been involved with that. And they go to a hospital that I think caters to people outside Guatemala. I think they have a hospital, and visiting surgical teams can come in, use their operating room, operate on the patients, and then leave. And 1 week there might be a plastic surgery team, and next week there's an orthopedic team. And but there's no local doctor involvement. They have, I think, nurses, but basically their team, I think they bring instruments, and I don't know if they bring anesthesia with them, but it's like the very early stages of global trips, the way it was 30 years ago. So this new one with OpSmile, I didn't know about, but I'll ask Dana. I wonder if she's trying to expand into something with more sustainability and
Yeah, and it
Yeah.
sounds like they're interested in potentially sending people to us for exposure here. So it may be more of a visiting scholar type position.
oh yes, okay.
But yeah, I think I asked to see if we could have a call about it and see how that could be organized or supported.
Yeah. Well, good. I'd say, I mean, in our division, Dana's sort of she's committed to this program in Guatemala, and maybe this OpSmile one is connected or similar or something, but
It seemed to be connected, and she also said that there was a potential donor who was interested in supporting some of it. So, yeah, it all seemed to be connected. So yeah, if you can
Yeah.
connect with her, or we
yeah,
can, get on a call in the next couple of weeks and brainstorm and see, what they would like to do and how they would like to do it, and how we can as a group work on supporting them. I think that'd be great.
good. I'll do that.
Fantastic. I was going to ask you something else, Brad. Did you ever get back to to Peter and Misumba from Tanzania, the plastic surgeon who's the big award winner for the plastic surgery conference, the meeting?
No, I will ask Jay. You sent that email around, and I said I think good idea if Jay would
I haven't heard back.
be in favor, and then I never heard anything from Jay, so I will.
You can-
Yeah, thanks for the reminder. I will ask him.
So
I mean,
Peter, yeah, it's for the group. Peter Nsumba is a plastic surgeon in Kijabe Hospital in Kenya. Yeah, it's in Kenya. And he runs the plastic surgery residency, I believe, in Kenya, in Kijabe, and is very well established. Also does hand surgery, although I don't think that they have a hand fellowship there. And is finishing up his PhD as well. And it's just very well established and connected to Vanderbilt, which is part of how I met him, and I've met him just giving board exams and things like that. So he had reached out. He is the awardee of the sort of main humanitarian award by the Plastic Surgery Foundation this year, and so he's coming to the U.S. and he wanted to come and visit Utah and wanted to come and visit us if that's a possibility of sort of combining his trip. So he's trying to see how we can work that out. So, which would be great, to have esteemed visitors like that come and join us for a period. So I think there's
so
something.
Sue, do you have any idea if he would need funding to come here?
I think he has funding to go to the plastic surgery meeting. I think he would probably need
Right.
funding to come from Dallas, from Texas.
Yes,
And so
yeah, and that meeting that he's coming to, that's our national meeting. That's at the same time when Gia Lewis was available to go to Ghana.
and it's also the week after the American College of Surgeons conference.
Yeah,
There's a lot of overlap there that might be a little tricky. So
okay. I will ask Jay.
I think those are other things that are going on. And then, Brad, I don't know if you've met Hafsa, was one of our new staff who's sort of taking over for Jonathan. And Hafsa is available to help many of our teams based on what is needed. Her background is more public health, Anna's background is more education. So depending on what your needs are as you develop these curricula, especially, just let me know and I can connect you to the right person, so that you have that additional expertise.
Yes, all right, thank you.
So great.
Great.
Other comments from anyone? Questions for Dr. Rockwell from anyone? Suggestions? We'll have time going to Ghana at some point. Gia Lewis also wanted to come to Rwanda, so maybe I'll go with her to Rwanda while the plastic surgery meeting is occurring, and then she can meet you in Ghana on the way back.
Yeah, all right.
Figure something out. So, okay, great. Others, Han, how's your summer going? What are you working on this summer?
I'm doing good. I think I emailed you back regarding Dr. DeVries' work, and I was just wondering, asking for some guidance. So I was just waiting for that.
Yeah, I just emailed her about it, and so we'll see what she has to say about what might work. And so hopefully she will get back to me and or you directly to work on that project. And that was a project that she started several years ago, looking at innovation and looking at surgical innovation and as well as I think some component of like need for innovation that addresses the climate impact of surgical care, including like waste management and hazardous waste and all these different things. But that's a project that hasn't found a person who's willing to work on it and get it to the finish line. So it's sort of been in various stages, and various people have worked on it in bits and pieces. So I think that could be a good summer project if you have time, if you have dedicated, a month or 6 weeks to kind of work through that one-on-one with her, that could be a really productive thing to do.
Yeah, project looks great. I just don't know what direction she wants me to take this or what guidance I could.
Yeah, so I just reached out to her, and I'll let you know hopefully later today.
Yeah. And then I also reached out to Anna regarding the Intro to Global Surgery program and just kind of waiting for her response on some stuff. So
yeah, great. Yeah, that sounds good. I'm sure Anna will respond by email. Other things, Kimberly, do you want to make the announcement about the 28th meeting?
Sure, yeah. So we're hosting along with the CMI group global health showcase, a global health innovation showcase, and that's scheduled for June 28th at 3:00. It will be in the new Helix building because it will be open at that time. So we have one of the classrooms reserved there. We have about 10 speakers, I believe, who are going to be presenting the projects that they're working on. So I sent out save the date to our group, and we'll also be including the Department for Global Surgery. So I'm working with Stacy, and then Suda, I'm also working with Nikki Tonks for her to add that to the newsletter so everyone will get that notification. So that is happening at the end of the month, and you should be receiving more emails from me with more specifics coming up. So super excited to be a part of this, and I think it will be a good thing. And the more people that we can get involved, the better.
Yeah, and hopefully it's a forum for everybody to present about different projects and different things, and just showcase what we as an institution are involved in global health and global surgery and innovation, because we don't have a venue for sharing that kind of work at our institution, because we don't have like an annual global health conference or things like that. So this is sort of a smaller scale, and maybe it'll evolve to that one day. And in the past, we certainly had the Extreme Affordability Conference, which some of you may know about or remember, and that was specifically looking at innovation in global health and global surgery. And it would be like a day and a half long conference that Ray Price Price and Catherine DeVries had held up until about 2018. And actually the 2018 one was in Ghana with people like Taylor Randall, who's now our president, attending. So it was really like a well-established, well-known conference that obviously during, through COVID hasn't occurred. And so this is sort of one small step in the direction of restarting that, but at least gives us a forum to bring all the folks who are adjacent to innovation in global health and global surgery under the same roof, for an hour and a half. We'll start, we'll start with, I have 2 hours and go from there. It'll hopefully also have a small reception, with light food and drinks, but no alcohol though, for if anybody's wondering, because it's a hospital property. So can't be encouraging bad behavior at the hospital. So, but yeah, so just mark your calendars, June 28th, if you can come for any part of it. So.
And we will have a Zoom option available if there are any of you who would like to join who are not at the University of Utah. So we will have a Zoom option as well.
Yeah. And Laura, if you want to present from Kali, because I don't know if you'll be here by then, you're welcome to do that. Or it'd be great if you can present live as opposed to a recorded video.
Oh yeah, that would be great. I actually saw the email, but it wasn't like I didn't understand if I could, present something since I was going to be here in Colombia, like physically. I'm going to Utah in like July 8th or something like that. So I'm going to be physically here. So if I can present it and join you guys virtually, that would be awesome. Thank you.
That'd be great. And just probably like a 5 to 7 minute presentation, something like that would be fantastic.
Awesome. So should I email you, Kimberly, or?
Yeah.
Okay. Awesome.
Yeah, I'll put my email in the chat so you have it.
Yeah. And
Awesome.
our next step is sort of curating who's all available to be able to present and how they're going to be presenting. And so that's going to be one of our next things to kind of decide, if we can have 10 or 12 people present their work. I think that would be great. And then if those of you who can be here in person, it would be good to meet in person, just again to just strengthen our ties across departments and schools and things like that. So
Okay.
Hafsa and Anna, do you have any comments on anything else? What have I forgotten?
I don't think you've forgotten anything. You've been quite thorough, but anyone who has any educational concerns, just go ahead and email me. I can help with anything virtually even, or set up a Zoom meeting. Tian, I just got your email. I will go ahead and respond to that. Laura, let me know if you're good to go with everything on heading over here. And I think that's it for me.
Hafsa, you're relatively new in joining our group and the chaos that our group seems to have. Any comments or suggestions? Thoughts?
Just like Anna said, like I'm happy to help on the other side. She's helping with the education side, but in other things like with data analysis or any need assessment and stuff, if anybody needs any help, I'm more than happy to help.
Fantastic. Okay. Well, I think that those are sort of our main things. Hopefully, when Rachel comes back from Colombia, she can give a little presentation to us about her trip there and our next steps. And then we also hope to have one of our faculty, Susanna Cohen, who's a nurse midwife here in the Department of OB/GYN, who has done a lot of simulation work funded by the Gates Foundation and other folks. I'm going to see if she can give us a small presentation as in the next few months. So that's sort of what we have posted. And please send me names and links to folks who you would like to have on as speakers, so that we can just share and increase our network and see who wants to talk about what and how we can learn. I think that would be great. So, yeah, thanks, Laura. Looking forward to your ideas. Okay, in that case, I think we should dismiss for the day. See you all next week. And we can keep at it. Have a good week or so until we meet again.
Thank you.
Thank you.
Thanks, Suda.
Have a good one. Bye-bye.